Hello, hello, hello. This is Dr. Zarina. It's here. It's had a couple of technical difficulties, but you guys know me. I'm not going to give up on you. I'm here. I'm definitely going to still get this information to you guys. Try this one more time. If you get into the broadcast, you have welcome to Rebound Your Health TV with Dr. Z. I am Dr. Zarina, also known as Dr. Z. So come on into the broadcast. When you get here, hashtag MVP. We're going to try to start this all over. It was a few minutes of some technical difficulties, but we are here. Hi, Sharifa. Thank you for joining us. Welcome to the broadcast. Welcome. Hi, Isak. Thank you for coming to the broadcast. It's Rebound Your Health TV. Thank you. Come on into the broadcast. Hashtag MVP when you get here. Hi, Bree. Welcome to the broadcast. Hashtag MVP when you get in here. Thank you for coming to the broadcast tonight. I definitely wanted to share this information. We had an MVP follower who actually is here with us tonight. So thank you. Go ahead and click share. Go ahead and click invite a friend, at least one person, so that they can hear this information. Hi, Carol. Good evening, everybody. Welcome to the broadcast. Come on in. Hashtag MVP. Get into here. Guests get into action. I would love to answer questions tonight. That's what this is going to be about. I have a really interesting basically the topic for today, and I'm going to read off to you actually what the MVP follower, what the question was, and it was something that was actually followed on TV. It's funny how, sometimes that's exactly how things come about, but I really would love to share that, guys, with you. I'm going to give maybe 90 seconds, we'll jump right into it. How's y'all Thursday going, though? Let me know in the comment section. I've had a busy one. I'm still working really hard, you guys, to bring you, I'm so excited bringing you guys a book. Is it my first book? Actually, it is my first book, not the first time I authored, but I'm really excited to bring it to you, and I want to be able to tell you more, but I'm going to hold off a little bit, but a lot of you kind of been catching the buzz that I have wrote a book. It's in editing, and I'm so excited. I'm so excited to share that with you. 85 ounces of water. Woo, woo. High five. That's some MVP behavior. That's what I'm talking about. Hi, Dr. Jared. Welcome to the broadcast. Thank you for coming this evening to Rebound Your Health TV with Dr. Z. I am Dr. Zarina. I'm going to jump right in because we're a little bit behind because of the technical difficulties, but y'all are always rock stars. Y'all show up, and I really appreciate that because I see that y'all want to really get into action. That's why I wasn't going to let any technical difficulty keep us from what we're trying to do. We're going to get into action, our MVP action. Hashtag MVP when you get in here. For sure. Let me know that you're here. I would love to say hi to you. Let me know how your Thursday's going. But we're going to jump into it. Today's topic is hashtag MVP, the follower asked, right? The follower asked, hey, welcome to the broadcast. Please invite a friend. Hi, Maila. Welcome to the broadcast. Please invite a friend. It may not be applicable to you. Hopefully this information is. And my family in the house. That's what I'm talking about. Hey, family. Always represented. And I really wanted to be able to share this information with you guys. Let me jump in first and introduce to you myself. For those who don't know me, I am Dr. Zarina. I'm also known as Dr. Z, your sports medicine integrative pain management physician, here to help you rebound your health and ultimately get you to your what? Pain freedom. That's what this is about. And I do this from the inside out, the outside in, through my medical practice, through my concierge practice, through my Pain Freedom 101 MVP coaching program, as well as platforms like this and speaking engagements and authoring. I do all of this to bring this information to you guys because maybe you can't reach me locally, but you'll be able to reach me globally because that is how we have to make sure our reach is far. Hi, Latoya. Welcome to the broadcast. And if I missed anybody else, hi, Shanika. Hi, Dr. Ishana. And welcome. Mwah. Love you guys for showing up. I have a question from one of you, one of my MVP followers, right? That somebody from our tribe, our MVP tribe, had a question tonight, and I wanted to share the question with you because I figured if this was a question on their mind, then I'm sure some other tribe members, right? Some other people in our MVP community have the same question. So I'm going to read it off to you guys, and then definitely as I'm going along, please share any questions. Sometimes there's a slight delay, but I'm going to make sure if I don't get to you live, I'm going to come back into the comment section as well. Don't forget, you can actually also follow me on all social media platforms at Dr. Zarina. That's DRZARINAH on all social media platforms. And you can also schedule your free, still at the moment, complimentary, I think it's through spring, complimentary session to get your discovery session with me so I can help you identify how to get you to the next. That's going to be in the caption at the end of this broadcast, so stay tuned. All right, so let's get into what our MVP community tribe member actually had a question about it. They said, Dr. Z, I was watching an episode of Judge Maybelline this morning, and there was a case of a woman suing a massage tech because she said she had a deep tissue massage and that incapacitated her for 3 weeks with neck pain. Hi, Elaine. Welcome to the broadcast. That incapacitated her for 3 weeks with neck pain that required use of pain medication. The massage tech explained under oath that there was some pain that could be associated with deep tissue massage, and that the degree of pain would depend on how tight your muscles were prior to the massage. So this is what this tech is saying. And also how sedentary the client may have been prior to the massage, and how tight the muscles were prior to the massage, and some other factors. The MVP tribe member said, I have had massages before, but not a deep tissue massage. I've contemplated one, but haven't done it yet. My question is, for whom do you recommend deep tissue massages? And I'm actually curious how many of you out there actually had a deep tissue massage. Do like an emoji hand. Let me know how many of you actually had a deep tissue massage. And I'm actually even going to ask you even how many have had a, not just a deep tissue, but you might have even had like, what do they call it? Maybe it wasn't a masseuse is my point. Maybe you got some kind of, they don't call it massage with chiropractors, and they don't even call it massages with DOs ourselves, but you might have had some other kind of deep tissue treatment. Hand emoji, let me know how many of you have had that. So that was the first question of maybe 3 questions in here. So her first question was, I've contemplated one. My first question is, whom do you recommend deep tissue massages to? Well, first of all, deep tissue massages are generally going to be helpful for those who have muscle tension, muscle tightness. They may have restriction in the fascia, as we kind of talked about, some of you know, is that it encapsulates, if you will, the muscles. And it's a very thin but tough connective tissue that encapsulates the different muscles, and sometimes even the nerves and so on and so forth. So if you have some tightness or restriction in that muscle, or even you may even have some restriction in the blood flow even that goes through those areas, deep tissue massage can actually be advantageous for a person like that. Deep tissue, it's like you've had a deep tissue massage. Okay, and how was that experience? I would love to know. But it can have some relative contraindications under certain circumstances, and you do want to be aware of that. So number one, guys, number one MVPs, before you get a deep tissue massage, even though it sounds like a benign thing and something really like it's just a massage, no, you actually do want to let your physician know that you're interested in doing a deep tissue massage, so that you can have that conversation with them, and they can let you know if there's anything that you should be worried about, or not worried about, but considered or take in consideration before you do it. Or they may flat out tell you, I don't think it's a good idea. Some things that might be the case where you may have had a recent infection. You may be currently inflamed. I actually don't typically recommend, if you're like acutely inflamed, I don't typically recommend you doing a deep tissue massage, because what that's going to do is potentiate or influence or exacerbate, the inflammatory response and the swelling for that area that you're currently highly acutely inflamed for. Hi, Dr. Moon. Wow, thank you for welcome to the broadcast. Welcome to the broadcast. So that could be highly inflammatory or just exacerbate the inflammation in that area if it's highly acute, okay? So that's number one MVP. Talk to your doctor before you get a deep tissue massage. If it's not, and most of the time now, because of the way the laws are, the facilities at these different massage companies, they will identify it in the name if it's a deep tissue massage. And if it's not, then it's not. So otherwise, relatively speaking, you can get a nice gentle one. But if you have acute inflammation or even something like rheumatoid arthritis, right? That's some of the autoimmune inflammatory disease processes. If you have that, or you suspected to have that, or they think you might have that, but you haven't had a definitive diagnosis, talk to your physician before undergoing a deep tissue massage, okay? So that's number one. I have a couple questions coming in. Like I said, it's like you've had one. Hi, Dr. Moon. Carol, let your physician know. Yes, MVP action. Thank you for getting that in there. Wonderful. It's like your experience was wonderful. A day afterwards, cured pain in the shoulder area that you had for months. It can, and I actually can say that I've done it as well for patients. So that's awesome that your experience was good. I am currently seeing a chiropractor right now. I've been going last 2 weeks, twice a week. Okay, awesome. And Latoya, let me know, are they doing deep tissue, or are they doing more of adjustments where it relates to the spine, kind of like the popping type of thing? If and also, how's your experience going as well? That's actually really could be really helpful for me to kind of help guide, if anything. Okay, so that was the question number one. Let me know if you have any questions about that. So that's the answer to that question. Talk to your physician first, because deep tissue massages, for the reasons I just gave you, if you're acutely inflamed, if you have an autoimmune disease process that maybe it could potentiate a flare, so you want to talk to your doctor to see if there's any contraindications for you specifically that could be a reason for you to avoid a deep tissue massage. The other thing is, if you do go do a deep tissue massage, make sure that you hydrate before and after, because it is releasing toxins. It is releasing toxins, and that's actually, I think, part of her second question. So our MVP Tribe community member said, for her second question, is it for everyone? No, which I already kind of answered that. It's not for everyone. So that's the question number two. And then the question number three was, should you lead up to deep tissue massage with other techniques first? And I think, if you're still here, I think I saw you, Mom Sharifa, in the out here right now in the broadcast. If you are still here, you can clarify that for me. But I think what you're asking me by basically, should you do anything leading up to that deep tissue massage? Hydrate. That is one of them, okay? You definitely want to do that. And then also, honestly, I would advise you to stretch. Now, that is something that if you're going to do a deep tissue massage from a tech or something like that, there are differences in those people who actually are providing those deep tissue massages, right? I do deep tissue massage. I don't call it that. I call it muscle energy and manual muscle energy and things like that in my practice, or I do other types of grasping techniques and things like that we could, again, I don't want to go into that just yet, but there are, other things that you do, and that's physician guided, right? But then you go to a massage parlor, which those are not doctors, although they are supposed to be trained and certified to do these massages. So check their credentials and make sure that you're comfortable with those credentials are, so that you know what to expect and what their knowledge base is. Ask the questions. They're ever going to blind. It's your body, so you definitely want to make sure that you're asking those questions, because you need to protect that. Hi, Nadira. Hey, now you out here being grown. Yes, I'm out here being grown. I love that. Inside joke, but I love that you came. Welcome to the broadcast. And then Angela, Habib, yes. Welcome to the broadcast. But yeah, that's the answer to that question, guys. Okay, you want to make sure that you ask the right questions, because not all massage therapists are created equal, and chiropractors do them. DOs, which is doctors of osteopathic medicine, like myself, do those. But again, in variations, and their knowledge base, of course, right, is going to be variable depending on their training and their expertise. So that's really, really critical, and thank you for that question. And let me know if I answered that question correctly, or the way you was asking it. Maybe make sure I understood that question right. So those are things you want to do. Hydrate before. That's one thing you can do leading up to it. Make sure you eat a little something, because you don't want to get lightheaded, okay? And then stretch. You do want to kind of do a light warm-up, because, again, like the text said on the TV under oath, is that it is true that if you're severely tight and you have a lot of tension that's maybe built up for months, kind of similar to what Isak said, he had months of a issue. I'm not sure what your exact issue was, but as oftentimes I'm going to have to do something in the office, even myself, to prepare the muscle, right, to receive that deep tissue. So you don't just go in there and start gnawing on muscle. That's not what you want to do. That's going to be, again, make the experience either worse, or the pain or the soreness can be more exacerbated after that deep tissue massage if you don't prepare the muscles, okay? So that actually is important. And a lot of techs or massage therapists, again, depending on the experience and how they were trained, they will tell you that, or they will do it themselves before they get into the deep tissue. There is like a preparation, if you will, of a softer technique that they're going to do before they get into deep. You shouldn't just go from 0 to 60. And if you notice that and you're laying on the table and you notice that they went from 0 to 100, speak up. I know a lot of people who get off the table after an hour of deep tissue massage, and they complain after they get off the table, but they really was feeling uncomfortable or pain during. Don't allow yourself to do that. Speak up. You're the MVP, right? Put that MVP in action on the table, no matter where you are. You want to speak up and let them know. There's been times where I'm doing certain assertive, aggressive techniques with a patient. And again, I'm always going to be talking to you throughout the whole process. Is that too deep? So on and so forth. But that's my, that's kind of my MO, to make sure that I'm in constant communication with you, to make sure that we're moving in the right direction and you are completely comfortable throughout the whole entire process. So that's something that's extremely important, guys. Actually, extremely important, that you want to make sure that you're communicating through the whole entire time if you need be. If it hurts, it's painful, whatever, communicate that. Hi, Cicely. Welcome to Rebound Your Health TV. So I have a question here. Ask the right questions. Yes, ask the right questions. That's somebody say, well, what are the right questions? Those questions are the ones I just talked about. So thank you, Carol, for pointing that part out. Is that you want to ask about their credentials. You want to ask them about what is the technique behind it and the training behind it as well. And ask them, should you prepare the muscles, or will he or she be doing that prior to the deep tissue massage? Those kind of questions is what I'm asking. And any question that I didn't just say, this is maybe something that you're concerned about that comes into your mind. You want to make sure you answer those questions, okay? That's your body, your temple. Make sure that you take care of it. Yes, they're using equipment that makes piping sound. Okay, on my neck. Oh, I know what you're talking about. And back area. Then he uses a massage around the lower back and hip. Painful for me to stretch it. Feel like I'm upper body. Okay. Yeah. Okay. Awesome. That sounds like that's going pretty good for you. I think I'm going to stick to someone rubbing oils with no more pressure than it takes for the oil to be absorbed. I think I see what you're saying about that, Carol. I do use different oils and essential oils when I perform any kind of deep tissue treatment. I don't really call it massage. It's not really what I'm doing. But when I do any deep tissue treatments, typically I'm going to use an essential oil or something like that. That is actually the oil base itself. Typically the ones I use are known for also decreasing the inflammation in the area, right? So it's kind of a twofer when you get the oil, the appropriate oil, as well as the deep tissue treatment to make sure that we can, maximize our goals for you getting out of pain. Okay. So then her next question was, is it for everyone? We answered that. Should you lead up for? Do you recommend them at all? I do, under certain circumstances. Are there other exercises or modalities that accomplish the same results as deep tissue massage? So that's kind of what I was alluding to before. A few things that you can do on your own without going to a facility are foam roller. Yay! People either love me or hate me for mentioning it or telling you about it. And most of you love me once you benefit from it, but you hate me for telling you to do it. Because they can be, hi, Mr. Bala. Hi, Mr. Bala. Welcome. What is the difference in acupressure and deep tissue treatment? Great question. So first of all, and then I'll go back to the other modalities and treatments that you can do without necessarily going to a masseuse, okay? And so I won't forget to that. But to answer Mr. Isak's question, acupressure actually is kind of consistent with acupuncture in the sense of where those points are. And they're based off meridians. And meridians is actually, again, Chinese medicine that's based off of looking at the organ systems, actually. It's based off the organ systems. So it's not so much like, when we talk about the spleen and the liver, things like that. We look at different points that are associated through the skin that actually help to influence the liver or influence the spleen or influence the abdomen and so on and so forth. But the difference with treatment, with the deep tissue treatment, is literally looking at not meridians, nothing about in a more Chinese medicine way. It's opposite of that, where they're literally looking at, or we were looking at, because I do both. You're literally looking at just where is the focal point or focal pain. So we're looking at that focal point, and that's where they're going to go for trying to relieve a trigger point or something like that. And there's different ways that you can relieve a trigger point, either manually, or you can do it through an injection, or you can do it through dry needling, or you can do it through acupressure kind of points, but it's technically a deep tissue. So I hope I answered your question there. Hi, Shanita. Welcome to the broadcast. Welcome to Rebound Your Health TV. Hi, Joanne. Welcome to the broadcast. I have a foam roller for my ATB. That's because you're an MVP, Joanne. I love that. you'll have to tell me all about the roller. Yes, Carol, you're supposed to know all about the roller. Definitely going to get you on that roller for sure. The foam roller, so let me go back to that. And if you have some more questions, please let me know. But that was a great question, Isak, and I hope I answered that. If not, again, feel free. You can inbox or schedule one of those discovery sessions and we can talk some more about that. Also, CMT, go Joanne, MBT, MVP action there. So I was going to explain to you some other modalities that you can do at home. So one of those was I started off with foam roller. And it can be, sometimes they're really dense. Sometimes they have little knobs on them. They're about yay big, so about this. And they can be either short or long, as long as your body. And what they help, again, is to deep tissue or to help decrease restriction in the muscle and the fascia, also improve blood flow and help reduce pain, as well as, did I say blood flow? Blood flow, yes. So those are the main aspects of that. One thing that I actually did talk about foam roller, gave a whole broadcast dedicated to foam rollers many months ago, and you can find that on YouTube and previous broadcasts if you missed anything. But we talked about the pros, not the pros and cons, but the do's and don'ts of foam rolling, okay? So please check out that video to make sure that if you're going to initiate, you want to make sure that you do it the safest way possible. It can be hugely beneficial and transformational for your entire body, but you want to make sure you understand the do's and the don'ts. So please visit our YouTube channel. Don't forget to subscribe so you can catch all the rest of our videos. But that is definitely on there as well to make sure that you know the do's and the don'ts of the foam roller. But that could be one that you can do at home, and you may even not need to go to a deep tissue masseuse, okay? The other thing is a tennis ball. You can actually use a tennis ball. I usually typically like that for the plantar fascia, like the bottom of the foot, or the shoulder, as Isak alluded to. That actually can be helpful in the shoulder blade area or between your scapula, or even kind of in the upper neck area, in the upper traps. That could be really helpful. Tennis ball can be helpful to create the deep tissue. So that's another one. So MVPs, get into action. I already said to please do that for me. Number one was foam roller. These are alternatives to deep tissue massage, okay? Alternatives to deep tissue massage that you could do on your own so far. One was the foam roller. Two, get into the action, please. For the other MVP people that are going to come and look at this video later, you guys always are rock stars with that, and I really, really appreciate it. And I know the other fellow MVPs appreciate it too. So that was number one was foam roller. Number two was a tennis ball. Number three is a roller stick, okay? That looks almost like a rolling pin that you knead out dough with. And I've actually had some people just use that instead of going to the athletic store to get an actual one. And this could be helpful for those who may have difficulty getting up and down off the floor, because the foam roller does require kind of a full body attention. And that's why some people try to avoid it. But I actually encourage you to challenge your body and those accessory muscles to actually get on the ground to do that if you can. But starting off, if you wanted to try to work your way up to that, is something that's called a foam roller stick. And it literally is a stick. Some of them have little knobs on them as well that gives you a deeper massage when you do it. And you just roll it along that muscle, be it the bicep or the quads, right? The front of your thigh or the back of your thigh. Even the bottom of your foot, where you're holding it on either end of the stick and you're going to roll back and forth with your hand. And a lot of people can do that sitting, sitting in a chair, as opposed to having to get on the floor if they have issues with getting back up, especially if you're, live alone and you have difficulty getting up and down off the floor by yourself. Then the roller stick actually can be helpful as well. Okay, so that was number three. And then number four that you can also use as well is actually, again, as Mr. Isak pointed to, you can actually use pressure points right on that muscle where you are hurting. Usually if it's in the front of your body, or you have a partner or someone that can help you, using the flattest part of your thumb. And if it's a pinpoint area, then you can actually rub that area, or just hold that area if you're having pain, and hold it for like 30 to 45 seconds and see if you get a release. Hi, Miss Sandra. Hi, Zakia. Welcome to the broadcast. Welcome to Rebound Your Health TV. Thank you for coming. Thank you for coming. Invite a friend. Share the video. Hopefully this can help you or somebody else. Okay, so that was number four that you could do on your own. Okay, these are things that you can do on your own, short of the deep going to a masseuse, that actually could give you the same benefits if you do them appropriately, okay? And then other things you can do from a medical perspective is cupping, okay? You can also do something that's called a Graston technique, which is kind of aggressive for someone, depending on your needs. It can be somewhat of aggressive deep tissue treatment that really can help not over the fascia, but tendons and ligaments as well. What it does is breaks up adhesions and restrictions. Sometimes you build up little calcifications if it's been chronic enough that you get adhesions that's causing tension and restriction in your muscles along the tendons and ligaments as well. So we can help relieve that and augment that by doing something that's called the Graston technique. And they use this technique, you know, even on the NFL level. You know, it's just very ubiquitous, kind of known all over. So Graston technique is one, cupping is another, okay, that can be helpful. Gua sha is another technique that we've used in the office as well for deep tissue. Some of you, I know, because I saw you in here this evening, you've been in my office and you've had that, and you've got a lot of relief with that. And I haven't seen some of you back, so maybe that's a good sign. Well, I didn't see you back for that at least, so that's a good sign. But yeah, gua sha is another thing which is based on a Chinese medicine kind of realm as well. That is a deep tissue treatment to help potentiate and elongate those muscles, break up adhesions, and improve blood flow, decrease swelling, decrease inflammation, and improve your pain symptomatology. Okay, so we talked about gua sha. Now I'm giving you alternatives to deep tissue massage, masseuses in a medical realm. Okay, so Graston technique, gua sha, cupping, manual osteopathic manual manipulation, chiropractic treatment sometimes, depending on, because, you know, again, they do deep tissue massage. They don't call it deep tissue massage, is my point. So DOs and chiropractors, medically speaking, can also help potentiate that as well. Do you recommend wet or dry cupping? Somebody has very knowledgeable about some of that. I recommend dry. And I recommend dry, unless I've seen both. I've mostly trained doing dry, which is why I do dry. And I'm recommending dry not because I do dry and not wet. It's mostly because of the training. I'm not really sure in terms of America's training. It goes back to certification and training, put it like that. So that's a great question. And just for those who are not sure, what is wet cupping? What is dry cupping? Dry cupping is Dr. Jacobs. Dr. Jacobs does wet cupping or dry cupping? Let me know that, Carol. If you saying he does both, does he do dry and wet? And Dr. Jacobs is a magnificent physician, just a brilliant, brilliant man that trained me in residency and really, really inspired me along my path. But anyway, but wet cupping, for those who don't know, is when you use a cupping technique, again, kind of Chinese medicine based for so very many thousands and thousands of centuries, that you use a cup literally on the muscle. Typically, you're going to use a base, like an oil base or cream base, to make sure that you're kind of preparing the muscle. And it helps to, again, relieve the tension, increase the blood flow to that area. Because sometimes your issue is that you have a lack of blood flow to that area, and we need to bring blood flow to the area in order for it to heal. So the cupping actually allows that to happen and also pulls out toxins. Well, the wet cupping idea is that you make a little incision in the skin or prick in the skin to allow that when you put the cupping over that area, it literally draws the blood into the cup. Well, the idea is that, but it's only the idea or the philosophy is that is what it's drawing is the toxins. So the philosophy and the idea is that they believe it brings out is more aggressive form of dry cupping, basically. But again, you have to be very careful about people's techniques, their cleanliness. Are they using aesthetics or not? How did they prepare your skin when they did it? Because if you have even the slightest infection on your skin, and we all carry staph, by the way, guys, we all carry staph on our skin. It doesn't all turn into infections, but what if you have staph in your skin? Of course, you're supposed to use the appropriate techniques, and then you get an infection. So, not that, again, you just have to make sure you're in the right environment, under the right position, and you do your due diligence with their credentialing and certification. I do know They're not in Georgia, but that I watch and respect that they do it. But they got their training in China, and primarily that's where actually where they treat mostly. So I don't knock wet cupping, but I prefer dry cupping because I also believe in less is more oftentimes. Do be as minimally invasive as possible to get, the biggest outcome. And if you can get the same impact and the same outcome with dry cupping, then go for dry cupping, right? Why jump to wet cupping if you can get the same impact without putting an incision in the skin? That makes sense. Hopefully that was helpful explanation. Because again, I'm not knocking wet cupping. I just try to do conservative things if it's going to give you the biggest bang for your buck. Bring out the bazookas later if you have to, but don't bring out the bazookas if you don't have to, if that makes sense, okay? All right, awesome. And I think that was her last question. This has been awesome. Thanks for being so participatory. Let me make sure I answered all her questions. Are there any exercises that accomplish the same results or deep tissue massage? Yeah. So that kind of goes to the modalities that I was just talking about. And all the thing, guys, is about prevention. So the fact that we would love to avoid needing deep tissue massage, right? Because most of the times when people get that, a lot of times they're already in a lot of tension. They already have a lot of tension. They already have a lot of pain. So we want to be preventative. And one way to be preventative is this very question that she just asked about any exercise I can do to be preventative. Yes, stay limber. People underestimate and they minimize and they neglect and they treat stretching like a stepchild. And you shouldn't. Strength is important. Flexibility is equally as important. I think I did a YouTube broadcast on that so you can go find that video as well. But stretching is equally important. And you actually will set yourself up for injury. My athletes do it all the time because they hate stretching, but they love getting strong. But they put themselves at higher risk for injury when they're not limber and they don't have the flexibility. So you can be strong and not flexible, or strong with restriction. That's not going to help optimize your function. That's not going to help optimize your quality of life. So stretching on a regular basis, when you get up in the morning, a light little warm up. It doesn't even have to be extensive. You can get out the bed and do 20 high knees, and high knees, right? Y'all know what I'm talking about. Do 20 high knees, and then and do some stretching right after that, right? To get in particular, putting very a lot of attention to your spine, your neck and your lower back and your mid back spine when you're doing your stretches, as well as your upper body, as well as your lower body. So you want to do that on a regular basis. I typically recommend people do that when they wake up and before they go to bed. And if you can put it in during the day as well, which you should be doing, you all know that sitting is the new smoking. I did another video broadcast on that as well. Sitting is the new smoking. So you want to make sure that you're doing that through your work day anyway. Every hour you should be standing up and doing something physical. I don't care where I am. People will tell you, those who know me, you can see me in Target and you might see me doing a couple lunges. I literally don't care. I don't care who's looking. Because what? It's my life. Meaning I'm going to try to potential my life as best as possible. Live my best life. So don't be embarrassed. If anything, they're looking in there and all wow, she get it in no matter where she is, right? Don't worry about the looks. Who cares? You're going to make sure that you get your lunges, your squats, your stretches in. And by the end of the day, your body's going to thank you. It's about pain freedom. Rebound your health no matter where you are. Thank you for joining me, guys. If you don't have any more questions, I'm going to end the broadcast now. Again, I love this topic. If you have any more questions or you'd like me to cover other topics, go ahead and submit those to DM me at Dr. Zarina on Facebook. That's DrZarinah. And you can DM me some topics, direct message me some topics. Myself or my assistant will get those, and we will put those into the broadcast and have another conversation about it. I want to talk about what's important to you. That's what this is all about. So it's not about, I want to talk about what's important to you. So this broadcast is for you. It's your broadcast, okay? Look at it like that. Hi, Charmaine. Mwah. Welcome to the broadcast. Thank you for coming. Please invite or share this broadcast so it can help you or somebody else you know. You know I love you, so thank you for coming. Mwah, mwah, mwah. And thank you guys for coming this evening on 8 p.m. in spite of the technical difficulties. But you guys will see me again next week on Thursday at 8 p.m. And I'm so happy that you came. Again, I am Dr. Zarina, also known as Dr. Z, your sports medicine integrated pain management physician. Here to help you rebound your health and ultimately get you to your what? Say it with me, guys. Pain freedom. I do this from the inside out, the outside in, through my concierge practice, my MVP 101 Pain Freedom Coaching Program, my authoring and speaking engagements. I'm here to help you. I'm here to help you. This is your platform. This is your TV show. I'm so glad you guys here. I look forward to connecting with you guys as well. Don't forget that you can contact me for a free complimentary discovery session, and the link will be up below in the caption right after this broadcast. And you can also see us in the MVP Lifestyle Facebook group with Dr. Zarina. See you guys soon. Mwah.